were told they'd get treated for their bad blood. Instead, hundreds of poor black men became participants unknowingly in a shocking and truly shameful chapter of American medical history. In 1932, the United States Public Health Service launched an unethical research project to examine the effects of untreated syphilis. The project was called the Tuskegee Study because it recruited 600 black men living in Tuskegee, Alabama. Researchers told the men that they were being treated for bad blood, a term used locally to describe anything from fatigue to anemia. They promised the men free medical treatment if they participated. While 2/3 of the men in the study were confirmed to have syphilis, not one received proper treatment for the disease they had contracted.
So this was a study in which there was no consent on the part of those who were being studied. Also deception on the part of the U.S. government.
When penicillin became the recommended treatment for syphilis in the 1940s, Tuskegee researchers scandalously withheld the drug from the men in the study so that they could continue to chart the course of the disease when untreated. Many patients experienced damage to their vital organs and nervous systems, and for some, the lack of treatment led to death.
The great shame of the study is that the men thought that they were being treated. Treatment was withheld from them, even after it was very clear what kind of medical treatment would cure them of syphilis.
In 1972, an Associated Press article exposed the Tuskegee study after one of the participants brought the story to a civil rights attorney. Only then, after 40 years, was the study brought to an end.
I'm going to be talking to you about black women in science, and very specifically how black women, typically in particular black slave women, were used as experiments, science experiments, in a sense, guinea pigs, for some very famous and well-known scientists and doctors. In general, though, just to give you a context, experimenting on black slaves was very popular. It was the norm. Not to say that everyone was for it, but it was done quite a bit. For example, Thomas Jefferson experimented on his slaves because he wanted to prove that vaccination was better than inoculation. So he did this by experimenting on 200 of his slaves, his son's slaves, and his neighbor's slaves. And then after he found out that the vaccination didn't kill anybody, he then gave the vaccination to his white family in Monticello. And then specifically, though, with gynecology, black slave women were used, and that's what I'm going to focus on mainly this evening. From my research, what I found is that gynecology was almost built on the backs of black slave women. It's pretty remarkable. For example, cesarean sections were practiced and the surgeries on black slave women.
A Harvard graduate on staff at the University of Cincinnati named Eugene Sanger applied for government funds to continue this research under the title Metabolic Changes in Humans Following Total Body Radiation. Though this title is only a tiny semantic twist away from being a horror film, the U.S. government wanted to know how sustained radiation exposure would affect soldiers in the field. Plus, Sanger had good intentions. He hoped radiation exposure could provide medical relief for cancer patients. A win-win on paper, the tests began in 1960. The University of Cincinnati Hospital referred desperate cancer patients to Sanger, who explained his intentions while leaving out the bit about his partnership with the Department of Defense. Sanger's team also left out the treatment's potential negative outcomes, which left patients only being aware of the upside, which was their lives being saved by this new experimental treatment. From folks ages 9 to 84, each absorbed 300 rads over a few hours. This is like the equivalent of getting 20,000 chest x-rays. It caused nausea, vomiting, and hallucinations. And eventually, for at least a quarter of the participants, death from radiation exposure. But let's back up. These cancer patients referred to the study weren't prominent public figures or other scientists or professionals hoping to rid themselves of cancer. So who were they? About 60% were African Americans from low-income backgrounds. The tests continued for over a decade until Senator Ted Kennedy ended it in 1972.